So yeah, what is the difference between attachment science and attachment theory? First, we'll start there.
So in my practice, for example, we focus on really attachment theory or attachment science, myself and my team members, and we work in individual and group therapy and teach workshops all about this. And it's different from attachment parenting, and I'll get into what attachment science or theory is in a moment. But it's different because primarily because it's science based, which is why I use that word science. It's 60 years of evidence based theory on the parent child attachment relationship. Attachment parenting is so much easier to describe what it is for a moment because it's not that. It's quite shaming, actually. It's a style of parenting that may work for you. However, if it doesn't, it's a prescribed way of parenting that is set out as though it's the holy grail. So, the way to parent in order to build a secure attachment relationship with your child, and it's actually scientifically not correct. So, some of the behaviors that are described, while they are beautiful, amazing bonding behaviors, if they work for you, breastfeeding, co sleeping, baby wearing, they are not the one-way street to building a secure attachment relationship with your child. So whether you do them or don't do them, that's not the science. Okay, that's not what leads you there. And so it's really harmful actually because it can get many mothers, especially or fathers who are in a very vulnerable state where they're reading everything they can get their hands on. How do I make this child, confident, healthy little person and then big person in this world and a kind person? And how do I build a safe relationship with them? Because they hear the word attachment and then they see I've got to breastfeed, co-sleep, and baby wear. Like, okay, I just got to do those three things. And those three things, excuse my French, I swear a lot, are really fucking hard, actually. And so it's two problems. One, well, what if you can't do those things? Is that just, there you go, you've written off a secure attachment relationship with your child? No. And B, even if you can, and they're lovely, amazing things, that's actually not all of it. Those are just behaviors. So the science of attachment is way more nuanced. It's actually way more hopeful as a science. It is about the very unique, intricate, delicate, musical relationship that develops between every parent-child pair. So it can be different, you with your child and me with mine. And it is based on a sense of what's called felt security. And so, what attachment parenting did is they took proximity seeking, this idea of being close, proximity meaning close, and they made it very literal. So, literal closeness, baby wearing, co sleeping, breastfeeding, or chest feeding. Whereas in the actual science, the idea of proximity is not only in body and constantly in physical space, it's in mind as well. So feeling felt. I don't need to be necessarily wearing you to have your mind in mind, right? And actually, the importance of the child feeling seen and known and understood and safe is way more important than feeling, worn in a baby carrier, and it's way more nuanced, and we'll get into how one does it and what the science has taught us, but it's way more nuanced. The other thing is that the last kind of differentiation I'll make that's really important is attachment parenting talks about singular behaviors, like we said, whereas the science of attachment or attachment theory is really focused on the collection of experience moment to moment over time. So, baby wearing for 3 months is not what creates a secure attachment. It's all that collection of millisecond to millisecond. Anyone who's a parent knows how many milliseconds there are in a freaking day. It's all of those milliseconds together that build the attachment relationship. So that over time is really important.
So this leads me to the next thing I wanted to ask about because I this is what happens in my life. I put out a TikTok that's like something about, responding to your child, great for attachment. And then like 2 days later, I put out a thing where I'm like defending someone who was getting like so shamed for sleep training. And I felt so bad for this woman. So I make a video like standing up for her and being like, And then people are like, how do you have training in attachment and you're saying sleep training is okay? You're supposed to respond to your child. And then I'm like, oh man, Tanya, you want to come on the podcast and talk about this? Because, like, yeah, go ahead. Like, I was just going to say, like, it's hard to explain, like you were just saying. It's not these single events, but people want to hang on to that. So often when I put out a video about attachment, in the comments, you'll see so many moms be like, well, I have twins and sometimes I can't pick up the one because I'm trying to feed the other one. And like, is that okay? And I'm like, oh my God, people are taking this so in the wrong way. And I wish I could explain it better. I have a hard time. The best way I can explain it is just like, it's over time. It's like a ton of interactions and just like your overall relationship. It's not these single events. So can you speak to that just a little bit?
Absolutely. And first of all, I'll get reactions to this, and please do. I was once on a podcast, a sleep training podcast specifically, talking about sleep, and I'll circle back to it to answer your question. Um, but I got a lot of backlash, and I ironically kind of appreciate the conversation because I become really curious about, wait, what question are you asking? What vantage point are you coming from? So that I can try to explain the vantage point I'm coming from and maybe help one person start to see it a little differently, because we are existing in a culture where part of parenting is, it is so prescribed. There's so many ways to do it, which plays on the anxiety of parents who are trying to do it all. And so the combination of, here are the 50 ways to do it, and I just need to know how to do it, is actually really detrimental. 20 years ago, while we didn't actually name postpartum depression yet, the benefit, and that was truly problematic, the benefit was that there was a little bit less prescribed ways to parent. The idea that we parented on intuition was a little bit more accepted than it is today. And actually, that was the right thing, that intuition thing. That was the right thing, not all these prescribed ways of being. A lot of the importance of attachment science, before we get into sleep training specifically, and I'll apply it, is also this idea that because it's relationships over time and it's moment to moment interaction, there's actually not only okay if there are mismatches, mistakes, ruptures, as I've seen them called. It's not only that it's okay, but that those are quite significantly important. And they are important because they are part of how we as a unit build hope. So if I can get angry with you, if I can tell you not right now, I'm with your sibling. I'm a mother of three. I say that 10 times a day. If I say not right now, I can't, maybe even impatiently, 1 second. But then I say, sorry, honey. Your sister was talking to me, your brother was talking to me. I couldn't talk to all of you at once. I'm here now. I'm sorry I snapped at you. What I've just done, and that's called repair, is I've named it, but I've moved from that mismatch back to a match. And I've allowed our relationship to begin to make the building blocks of hope. We can move from a negative to a positive experience together. We can regulate ourselves when things go wrong and come back to balance, which we can talk about, if we talk about nervous system today. So we can tolerate frustration, and it's okay to have moments of mismatch, that relationships are filled with them. And the science of attachment shows us actually 70% of secure attachment relationships are mismatched. 30% are that perfectly in sync, right? So for the parent who asked you, is it okay I have twins? Absolutely. It's not only okay, we actually want some of these. So give yourself a pat on the back when you repair, and then after you've had a rupture. It's not just a, whew, thank goodness I repaired. It's like, great, I had a rupture because I'm human. And it's part of the attachment relationship. So that perfection striving actually can be quite detrimental for our children and for ourselves. Let's loop to the sleep training on that note. Sleep training is a really complicated question. And that's because I think we're asking the wrong question. We're asking, is it good for baby? And if we come with the question, is it good for baby? We're going to have a lot of noise because when you train a baby who would happily early on wants to be secure and comforted in that kind of little heart-shaped spot in between your bosom, if you're, a woman, then it will be really difficult for that child in the moments where you don't embrace them into that spot. We know this by science, evolutionary science. So, yes, if you're going to take it from the angle of is it good for the child? Nope. In that moment, it probably isn't the best. It's not what they want. It's a mismatch. They rather be held by you all night. The question, though, is not is it good for the child? It's actually the wrong question. It's where the whole thing gets messed up. Because the question should be, if it's about the attachment relationship, is it good for the pair? We need to centralize the pair. Is it good for the unit? Is it good for the mother and baby? Is it good for dad and baby? And that answer will depend on the unit. So if you are a mother who, I was this mother, who with sleep deprivation, as many of us will be, have a slow form of torture and we can't function. And we might be more angry, more anxious, for some, much more depressed. When depressed, that means you're less responsive, you're in a deflated, kind of defeated, flat affect, meaning not responsive state. Well, that's going to be pretty scary for your child if you're in that state moment to moment, day after day. Remember, we talked about collection. So if a sleep training is, 3 nights to 1 week, whatever, of mismatch, that's a really short, succinct period of time to the negative impact weeks and months and years of sleep deprivation could be on the relationship if the parent needs sleep. So to me, it's really the wrong question. Here and there, I have parents who've heard me speak about sleep training and they are embarrassed the other way. They say, I co-sleep. Is that bad? Like, absolutely not. I mean, it's not, by no means am I standing here or sitting here, whatever, speaking here, saying that that is an error. If it works for you and your family, if you are someone who's going to feel so overwhelmed with anxiety by the idea of training, and you're much calmer having your child in your bed, and you're willing to have your child in bed until whenever, and the whole idea of that feels more comforting to you and it works for your family, then great. Then the question doesn't apply to you. Then it's good for your family not to train. Right. So to me, we're getting in trouble with the sleep training thing because we're asking it wrong. And we're getting in trouble in general with attachment because we're asking it wrong. We're constantly talking about infantocentric viewpoints. What is good for the child? And that actually doesn't make sense if we understand attachment. It needs to be good for the pair. The mother needs to feel recognized. The mother needs to feel seen. The mother needs to feel safe, as does the infant, and actually more so sometimes in order for her to regulate her infant.